Well, on the one hand, there's good news on the vaccine front. On the other hand, Hamilton will enter a lockdown on Monday as the rate of transmission continues to increase at an alarming rate. Joining us now to talk about the latest developments on the virus is Dr. Zain Chagla, an infectious diseases specialist at St. Joseph's Hospital. Dr. Chagla, were you at all surprised to hear that Hamilton is entering lockdown on Monday?
No, I don't think so. I mean, we look at the province's framework. We've been in the red area essentially for 2 weeks, even more than that. And I think every single indicator on that list, the number of cases, the percent positivity, the reproductive rate, the healthcare sector capacity, outbreaks in vulnerable settings, all of them have been going up, not down, unfortunately, in the last 2 weeks. And so, there's very little left in terms of being able to handle some of these businesses and places being open. It's unfortunate, but I think we had to do more to keep our community under control, given that we are headed into a fairly critical period.
Well, the Pfizer vaccine is already being rolled out in Canada, and today we learned that we're scheduled to receive thousands of doses of the Moderna vaccine, pending, of course, regulatory approval. Now, should people be concerned about getting one vaccine over the other?
No, when you go get a vaccine from any particular setting, from your family doctor, there are a number of different brands. And so, this is very similar. There are some fundamental differences in terms of the storage requirements of the vaccines, but, their mechanism is relatively the same. The data behind them is relatively the same. Their efficacies are about the same. And so I don't think there's going to be a particular preference for one or the other, knowing that these vaccines are coming in limited quantities at first. It's really what settings are predisposed to getting one. The 14 centers in Ontario that have access to the Pfizer vaccine will likely push out the Pfizer vaccine. And the Moderna vaccine may go to settings that have, a bit more, bit harder to get storage requirements. So some of the more remote communities into long-term care facilities. But, I think one or the other, they're both similar. They both have a similar safety profile. And again, it's which one to get rather than I want to get a single one.
Now, you just mentioned storage because we learned the Moderna vaccine no longer needs to be kept at very cold storage. Is that a game changer for Canada where the landscape is huge?
Yeah, absolutely. And, one of the hardest places to vaccinate, but probably one of the most needed vaccine places is long-term care facilities. And so this is ideal for those types of facilities, as many of them do have drug fridges, areas where these types of vaccines can be stored. The Pfizer requirement was great for healthcare settings where we could get these types of ultra fridges. But, unfortunately, in long-term care settings, which really do need it the most, it was a hard vaccine to get. And so I'm very glad to hear about this. And obviously, this is something to give. And again, similar to our remote and Indigenous communities where, we're fly-in communities where power security isn't as ideal, this is a good option for them, too, to make sure that they have access to a vaccine.
You make a good point. All right. Thank you so much, Dr. Chagla. Dr. Zain Chagla is an infectious diseases specialist at St. Joseph's Hospital. Thank you.